See Vitrea 7 workflow video on the calcium scoring application known as VScore. From the study list, left-click to select the patient. Left-click to select the VScore application from the Applications bar. Verify the proper series is selected from the series selector at the bottom of the screen. Then click Open at the bottom right or double-click on the VScore application to launch the exam. Once the exam loads, any calcification with a Hounsfield unit of 130, 3 pixels or more will be tinted automatically. Roll the center wheel to scroll, and we'll start identifying calcifications. If you do not prefer the color, you can turn off the tint by unchecking the Show Tinting at the left-hand side of the screen. Once calcium has been identified, left-click from the Vessel Selection menu to activate the vessel. The Select tool is automatically selected for us. The Select tool will let us hover the tip of our cursor on a chunk of calcification and then left-click to select it. If a mistake is made, you can hover over that chunk of calcium and notice there's a minus above the Select tool where my mouse is. You can left-click to deselect it when necessary. The Select tool will grab contiguous calcium if it's connected through multiple slices in that section of vessel. We also have a freehand tool so that we can circle areas of calcification freehand. Notice the tint on each chunk of calcium will update to the corresponding vessel. The freehand tool is a slice-by-slice workflow. Be sure not to miss any calcifications in the vessels. You can switch back and forth between the Select tool as well as the freehand tool. Notice the right coronary artery and multiple calcifications through multiple slices. With one single click, calcifications that are contiguous in that section of vessel have been automatically selected for us. If a mistake is made, you can use the Remove tool to remove a section of calcification if needed from a certain vessel. Let's imagine this little section in the right coronary artery is actually an artifact. By selecting the Remove tool, we can create a contour around that section of calcification and remove it from that vessel if needed. Notice how the tint returned to the original pink tint of the vessel. Once all calcifications have been identified, be sure to save your work by clicking on the snapshot at the upper right-hand corner of the screen. Our vessel selector box can be moved if it gets in the way of the anatomy by left-clicking and dragging. Be sure to select the appropriate report guidelines based on physician input at your facility. From the drop-down menu, we have the Hoff 2001 reference guideline, NASU 2002, and MESA 2006. Gender will come over in DICOM and be automatically selected for us, but this is a teaching case that we'll have to select automatically, that will not be selected automatically. We also have a CAC-DRS report guideline as well as an option to enable this. Click the checkbox. Select the number of vessels with disease and select the visual assessment as necessary. This will propagate to the calcium scoring report. Now that our workflow is complete, and we've saved our work by clicking on the snapshot, if we'd like to save a contiguous batch of all the images, we will go to the Batch tab at the upper left. We will do a manual batch so that physicians can evaluate the calcium score on this exam. We'll scroll to our Start slice, left click, roll the center wheel until our Stop slice, left click again. Verify the step size is set to 1 by clicking and dragging the slide bar. Enter a series description, and then click the Batch button to save a scrolling batch.